So welcome everybody. Here on the screen, you're going to see the items that we will review today. So your medical benefits that are moving from Aetna to Blue Cross Blue Shield, your dental program and vision are staying with MetLife, some changes to your voluntary benefits that are moving to MetLife, and then some enhanced benefits with Aflac. Open enrollment started on November 2nd, and you have until November 13th to complete your enrollment. This is going to be for all of your benefits. As Audra stated, you can go into the Darwin system and enroll for medical, dental, vision, and your Aflac. The benefits that you're going to elect start January 1st, 2021 and run until December 21st, 2021. So you are locked in for those benefits for the whole year, so 12 months. During that year, if you need to make any changes, you can only do so if you have a qualified event, such as marriage, divorce, birth of a child, things of that nature. Make sure you contact your HR representative from 31 days from the date of the event or before 31 days from the date of the event so you can take a look at your benefits and make any changes. In regards to eligibility, so all employees that have met the eligibility criteria are eligible for benefits, aside from yourself, your legal spouse, domestic partner, and children up to the age of 26. Now, for the children that are a little bit older, it doesn't matter if they're living at home, away at college, married, on their own, they may still be covered up to the age of 26. We're going to go over the medical benefits. You have two great options to choose from. So your first plan is called the PPO 2500, and these are with Blue Cross Blue Shield. So 2500 is the individual deductible, and 5000 is going to be the family deductible. Now, if you should meet that deductible in a plan year, you're going to go into that co-insurance or cost share with Blue Cross Blue Shield. Blue Cross Blue Shield will pay 80% of all coverages, and you're responsible for 20% until you meet that out-of-pocket maximum. Now, when your deductible is going to come into play is with major services such as inpatient hospitalization, outpatient surgery, MRIs, CAT scans, durable medical equipment. That's where you're going to have to worry about your deductible. If you just go in for your preventative care that's going to be covered at 100%, you do not need to worry about that deductible. On this plan, you also have co-pays for your regular doctor visit. So your primary care physician, your walk-in clinics, those are going to be a $35 copay. Specialist, it's a $60 copay, and you can self-refer to specialists. You do not need your primary care physician to write a referral. Also, just a reminder, the preventive care on this plan and the other plan is covered at 100% for yourself, children, and spouse. And under healthcare reform, there are 26 preventative exams that we're entitled to depending on age and gender. So make sure you schedule those. Urgent care, you have a $75 copay, and emergency room is $250. Now, if you go to the emergency room and you have to spend the night, you're going to be admitted, that $250 will probably be waived, but you will start to pay towards your deductible. Your pharmacy, you're going to pay the lesser of. So typically the local pharmacies have $4 generics. So the most you will pay for a generic medication is going to be $10. So you're going to pay the lesser of the 4 or the 10. Your preferred brand name medication is going to be $35. Your non-preferred brand name medication is going to be $60 or $120. Now, if you're taking any type of specialty medication or infusion type therapy, there are 4 additional tiers. Now, the summary benefit of coverage will be sent to you later today, and you'll be able to see what those additional tiers are. If you have questions to where your particular prescription falls, you can send me an email and I will send you the link or the list of prescriptions so you can see what tier they fall on. And that's going to include the specialty medication as well. Any questions on this plan? Okay, and a new program for Stockmen employees, a 3500 high deductible health plan. So on this plan, all services, doctor visits, sick visits, urgent care, pharmacy, emergency room, all those types of visits are going to be subject to your deductible. What is not subject to your deductible, which means that no out-of-pocket cost to you and any family members enrolled, is your preventative care, So again, those 26 exams that you're entitled to, depending on age and gender, those are going to be covered at 100%. Preventative prescriptions and FDA-approved contraceptives, those are all covered before deductible. Now, again, if you have a question, if your particular prescription is free, you can send me an email and I can send you that list of free medications before deductible. So how this plan works is you show your ID card to your provider. You're going to pay the contracted negotiated rate, whatever that cost is for all services rendered. Your regular doctor visit, a specialist, the urgent care, emergency room, and pharmacy, you're going to pay the contracted rate. Now with the high deductible health plan, you can open a health savings account or an HSA. So HSA is money that goes into an account to use towards these medical services, dental or vision, for yourself and your family members. Now, in 2021, Stockmens is going to deposit into that HSA account $50 per month to use towards your services. So you can also elect pre-tax dollars to go into that account, and again, you use those dollars for your medical expenses. Now, the money that goes into that HSA account, you own that account, you own the funds. It stays with you and it goes with you. We'll go over additional details in the next screen on the HSA. Does anybody have any questions on this particular plan? Okay, the health savings account. So in order to qualify to open the health savings account or the HSA and take advantage of the seed money that Stockmens is providing, one, you have to enroll in the high deductible health plan, which you have access here to. You cannot be enrolled or covered under a non-high deductible health plan. So if you're covered under a spouse's plan or domestic partner's plan, or you have another plan that has co-pays for doctor visits, pharmacy, emergency room before your deductible, that exempts you or excludes you from being able to open an HSA account. Also, you cannot be enrolled in any part of Medicare, any of the supplemental Medicare, A, B, C, none of those. You cannot be enrolled in any of those. You may be Medicare age and not enrolled in any of those parts of Medicare, and you are eligible for the HSA. But once you enroll in any part of Medicare, under IRS law or federal law, you can no longer participate in an HSA. And then finally, you cannot be claimed as a dependent on somebody's tax returns. So those are things to keep in mind when making an election for your high deductible health plan and taking advantage of an HSA account. So aside from the money that Stockmens is going to be putting into that HSA account, you can also elect pre-tax dollars from your paycheck to go into that account. So how that works is you say, let's put an additional $100 a month that's going to be deducted from your check. It's going to go into that Stockmens HSA account that's going to be open for that you're going to open. And then you can use those dollars to pay for your medical services as you need them. If you only go in for your preventative care and maybe a visit 1 or 2 a year, all that money that's in there is going to roll over to the next plan year and just continue to roll over. So there is no use it or lose it provision. If you leave the company, you take that money with you. That is your money. There are some IRS limits. So how much pre-tax dollars can you put into that account, or how much money can you put into that account? So that account can be funded in a couple different ways. Number one, Stockmens is going to put $50 in there for you per month. You can select pre-tax dollars to go in there, or if you want to put just money in there that you have additional savings and you want to move it in there, you may do so. Just keep in mind the IRS maximum in a calendar year for an individual for 2021 is $3,600. So you have to make sure that you back out the amount that Stockmens is contributing on your behalf, and that's what you have to contribute as an individual. And then as a family, it's $7,200. Now, a family is considered one plus under IRS rules. So it could be yourself plus a child or a spouse or an entire family. Again, keep in mind to back out the $50 per month that Stockmens is going to contribute $600 a year. You have to back that out from the $3,600 or the $7,200. Now, if you're 55 plus, you can add an additional $1,000 to those annual maximums, making it $4,600 and $8,200 that can go into that HSA account. Now, those dollars, like I said before, can use for medical, dental, vision, pharmacy, durable medical equipment. If your doctor can write you a script, you can use those HSA dollars. If he says you would benefit from yoga and writes you a script for that, you can use your HSA dollars. If he says you would benefit from Pilates and writes you a script, you can use your HSA dollars. There are a lot of things that you can use those dollars for. Any questions on the high deductible health plan or the HSA? Okay, and then
copay. Quick
go ahead.
question: copays and things of that nature, doctor's visits, those would all be subject to your deductible under the high deductible plan, then, correct?
That is correct.
Okay. In which you could use money from your HSA to pay for.
That is correct.
Okay.
Another quick note, a very important note actually. So, you're going to have the opportunity to open your HSA account with Stockmens Bank. I would recommend you do it as soon as possible before your first claim hits. As an example, if you go into the doctor in January and now you have a claim that's going to hit Blue Cross Blue Shield and you're going to owe some money. And if you have not opened your Stockmens HSA account, you can't use any of the money that's going to go in there to pay for that claim. But if you open it beginning of the year, even with $0, and you have a claim in January, you can fund that account with pre-tax dollars to pay for that claim. If it's a claim that hits and your account isn't open yet, you can't use those dollars to pay for past claims, only future claims. So very important there to keep that in mind when considering the high deductible health plan and the timing of opening your health savings account. And then another important thing to note is the money is going to go into this account as it's deducted from your paycheck and as it's deposited from Stockmens. So that's when those dollars are going to be available for you to use. Any other questions?
I just wanted to go back I might have misunderstood the question about the copays, but the high deductible, one element about it that makes the high deductible health plan unique is that it does not have copays. You're paying the contracted price, correct? And then with the PPO, there is a copay.
Correct. So whatever the doctor's charging you, that's going to be your responsibility, your portion, or your payment, if you will. I think the word copay is used to just say this is what my co-insurance or copay is going to be. So whatever, if you're on that high deductible health plan, whatever the doctor's charging you, the contracted negotiated rate for the doctor, facility services, pharmacy, that's your responsibility. And yes, you may use your HSA dollars to pay for that. Okay, this is just highlighting the few things that I already went over. And then next, we're going to talk about your flexible spending account. So your first medical plan, the PPO $2,500, pairs nicely with this FSA spending account because this, again, is pre-tax dollars that you select to go into this account that you can use for copays for yourself, for your dependents, for medical, for dental, for vision. And you can also enroll in this flexible spending account without enrolling in any other benefits. So it's a standalone product. So again, pre-tax dollars that you can select up to $2,500 for the year. It's front loaded on your Visa card. So when you receive the Visa card in January, it will have the full amount that you've selected ready to use. So if you know you're going to be paying for braces or procedures first of the year and you are enrolled on that PPO 2,500, or you don't have to be enrolled in any of the medical plans, you have that money ready to use, and then it's deducted from your paycheck for the rest of the calendar year. Unlike the HSA, for the FSA has a maximum of $500 that you may carry over. The HSA, you carry over all unused dollars, and that's your money, stays with you, goes with you. If you leave the company, this card gets turned off and you do not keep it. Also, any money in excess of $500 on the last day of the year, so December 31st, you forfeit those dollars or you lose them. And this does require an annual enrollment. The HSA, as long as you're in a high deductible health plan, that HSA account stays open and you just contribute the dollars that go in there. So a couple of differences and similarities, just the pre-tax is the similarity. You use it towards your medical, dental, vision for yourself and dependents. The HSA is your account, you keep it. The FSA, you lose it if you leave the company, or you may only carry over $500, and that's it. Any questions on the FSA?
Yes. Do we have to be signed up with insurance through the bank in order to sign up for the flexible spending account?
No, it is a standalone product. You can enroll just in the flexible spending account and nothing else.
Okay, thank you.
You're welcome. Any other questions? Okay, you also have access to the Dependent Care FSA or Flexible Spending Account. Again, pre-tax dollars that go into an account that you may use to pay your providers for child care or elderly care. You can use those funds as they're put into your account to pay them or pay yourself back. There are also maximums on the FSA, Dependent Care FSA. It's $5,000 annual election, or if you're married and filing separately, it's $2,500. Any questions on the Dependent Care FSA? Okay, next we're going to go over the Blue Cross Blue Shield resources. This is going to be your telemedicine provider going forward under Blue Cross Blue Shield. So yourself and any family members enrolled may use the Blue Care Anywhere. So this is your telemedicine, your Skype, telephonic consults with board certified physicians, counselors, or psychiatrists. You can use it at any time and at the beginning of the year and throughout the year, and it's at zero copays for yourself and any dependents. So the medical can treat things as, pink eye, cold, flu, upper respiratory, UTIs, anything that you know the symptoms of and a doctor may diagnose. They can write scripts to the pharmacy that's closest to you. So you can use this when you travel, when you're at home and you don't want to leave your home and go to the doctor's office and get exposed to whatever's going on there. It's a really good resource. Now, when you get your ID card, you're also going to get a welcome packet. And within that welcome packet, you'll see additional resources for Blue Care Anywhere. I would recommend going onto the website and enrolling and downloading the app to your telephone so you have it ready to go. Also on this page is the information on how to find a provider. So this is also going to be in your benefit guide that you will receive later today. But I just want to walk everybody through how to find a provider in your zip code or how to navigate through the system. So when you click on the link, you're going to come to this page and you're going to say, I'm not yet a member. You're going to click on this and then the type of coverage, how you're going to be covered is through an employer. And then this is where you're going to make your network selection. It is called the National PPO. And then you can search by zip code. You could also narrow it down by provider, doctor's names, places, etc. So, Audra, if you want to give me a zip code.
80920.
Thank you. So you can choose, like I said, hospital, urgent care. If you have the doctor's name, you can put the doctor's name. If there's a center, a medical center, you can put the medical center in. I'll just add some really good points in the last call that you could do additional searches on here. If you can't find it just with the zip code, you can narrow down your searches, and you could also narrow it down by distance. So typically we go to the doctor anywhere between home and work. So if you know you work 50 miles away from your home, you could widen that search, or if you can make it less if you would like, whatever's going to help. Now, if there's a provider or a particular facility that you have a question on, are they in the network? I'm not 100% sure. You can send me an email and I can take a look. But here in this zip code, there are quite a few that came up just with the word hospital. Again, you can narrow it down by specialist, doctor's name, facility name, center, things of that nature. Any questions? Okay.
You were talking about in-network. Do you know who we are in network with in Missouri?
It is called it is Blue Cross Blue Shield National PPO.
Okay. All right.
Now, in-network means that the providers have contracted with Blue Cross Blue Shield. So they've written a contract with them that they will not charge more than what the contract states. Out-of-network providers are free to charge whatever they want. You will still see a claim come through for out-of-network providers, and Blue Cross Blue Shield may pay them as well, but those providers have the right to balance bill or charge you the difference because there is no contract. Okay, next we're going to go over the dental. So no changes to the dental plan for 2021. The coverage and the rates remain exactly the same. So on this plan, you have $1,000 to use towards your dental services for yourself and each member enrolled in the family. So if it's yourself and a spouse and children, each of you get $1,000 to use towards your dental services. Now, children get an additional $1,000 to use towards our orthodontia, and that's a one-time lifetime benefit. So if you have a child that's enrolled and they've already used it for 2020, they do not get it for 2021. So it's a one-time benefit. So on this plan, your preventative care is going to be covered at 100%, which is going to be your cleanings twice a year, x-rays, things of that nature. That's all going to be preventative. Your basic services such as a cavity, emergency services, those are going to be covered at 90%, which means you're going to pay 10% of the cost. Now, if you use the basic services or the major services, you're going to be subject to a one-time deductible of $50 as an individual or $150 as a family. You only pay that once in the calendar year. So if you use the basic services, you will pay for that deductible at that time. If you use the major services and you've already paid it, you will not have to pay again. So the major services are going to be your crowns, dentures, things of that nature, and that MetLife will pay 60% of cost and you're going to pay 40% of cost. And if you've already exhausted that $1,000, you're going to pay all out-of-pocket expenses. Remember, you can use your HSA or FSA dollars to pay for those extra charges. Again, if you never use the basic services or the major services, you will never have to worry about those deductibles. Any questions on the dental? Okay, vision plan, no changes here. Same benefit and same premium, no increase to those premiums. So your exams that are available every 12 months, and it is a rolling 12 months, which means if you went to the to get your eye exam on July 1st, you have to wait until July 1st of 2021 or thereafter to schedule your exam. Okay, and that's going to be at a $10 copay. Your frames for retail is going to be $130 allowance, and wholesale like Costco is going to be a $70 allowance. Your single vision, bifocal, or trifocal lenses are going to be at a $25 copay. And your conventional or disposable contact lenses, you have a $130 allowance. And just a quick note on those contact lenses, when you go in and get your exam and buy your contact lenses, maximize those dollars. So use the full $130. If you have to get contact solution or extra contacts, do so. Because once you use that benefit, you've used it for the entire year. So if you walk out of the door and pay, you only use $100 of the benefit, you've left $30 on the table that you could have used. So just maximize those dollars. And then medically necessary or prescribed contact lenses are going to be covered in full after a $25 copay.
I'm sorry, I do have a dental question.
Okay.
So I know that it said on the Doncha it pays $1,000 one lifetime fee, but what did it mean where it says 50% on there?
That is going to be the co-insurance. So the preventative is 100%, the basic is 90%, the major services is 60%, or orthodontia is 50%. So typically what happens is when you go in for orthodontia services, the doctors will pay, the MetLife will pay 50% of the $1,000 at the beginning of the treatment, and then at the end of the treatment, the other half.
Okay, so it's still just $1,000 no matter what.
It's still $1,000 no matter what.
Okay, thank you.
Any other questions? Okay, life insurance, life and AD&D. So that is transferring over to MetLife. So Stockmens Bank will continue to pay for $10,000 of life and AD&D for all eligible employees at no cost. So the AD&D portion, the face value is $10,000. If you pass away due to accidental death, it's $20,000 going to your beneficiary. In addition, if you would like to purchase additional life insurance, all employees working 30 plus hours are going to be eligible for 5 times your annual earnings up to $500,000. 5 times your annual earnings up to $200,000 are going to be guarantee issue. What that means is no medical underwriting. So you will not have to submit an evidence of insurability this time around. Keep in mind, if you don't have any voluntary life insurance today and you want to purchase it next year, you will have to complete an evidence of insurability. For your spouse, the maximum guarantee issue is $25,000, and for children, it's going to be $10,000. Now, if you are enrolled today under the Unum policy and you have additional voluntary life insurance, we do ask that you complete the MetLife form, and if you want to keep it exactly the same, complete that form right across the top, keep the same, and just remember to update your beneficiary. So you'll have to complete one beneficiary form for the Stockmens paid life insurance. And then if you want the voluntary or you want to transfer the voluntary over to MetLife, you would have to complete a second MetLife form. And those instructions will be sent to you later today. One of the enhanced, yes.
On the voluntary, on the additional voluntary, if we choose to do that, will we have to fill out another evidence of insurability form and have the physical as well again, or will that transfer over?
So if you already did it with Unum, you do not. So that's going to transfer over. You do not have to do it again. An enhanced benefit with the MetLife is the benefit reduction. So as we start to age with the Unum policy, that life insurance benefit reduced. Under MetLife, the voluntary, there is no benefit reduction. So whatever you purchase, that's the value that it keeps until the termination of the policy. Any other questions on the life insurance? Short-term and long-term disability. So Stockmens Bank will continue to pay for short-term disability for all eligible employees. Some enhancements here. So the shorter elimination period. So this short-term disability starts to pay after the 7th day of illness, accident, or hospitalization. The benefit pays 60% of your pre-disability earnings up to $1,000 a week. And the duration period is 11 weeks. Now, because Stockmens Bank is paying for the short-term disability, there is no pre-existing limitation on this policy. The long-term disability policy is voluntary, and this benefit starts at the 90th day or after the short-term disability terminates. Again, it covers 60% of your pre-disability earnings, up to $7,500 a month. And this policy terminates at age 65 or normal Social Security retirement age. This policy does have a pre-existing limitation, which means if you're diagnosed by a provider or took medication 3 months before the effective date of this policy and then went out on disability claim, it would not be compensable. If you are enrolled in the long-term disability Unum and you have an existing condition and you've already satisfied that 12-month waiting period, and if you continue with the MetLife, you've already satisfied that waiting period, so you don't have to worry about that. If you're enrolling for the first time, this is going to come into play for you. Any questions? Okay, next we're going to go over the Employee Assistance Plan, or the EAP. So you do have 2 options to choose from. The first one is called Support Link. So this is available to all employees, whether they're covered under Stockmens benefit or not. This is for all employees plus their dependents, available 24/7, 365 with certified counselors and psychiatrists. You get 3 face-to-face visits per year per incident. Very important. There is No reporting. It's 100% confidential. Nobody gets any information as to why you called or who called. And then additionally, when you go onto the website, and you'll find this in your paperwork that'll go out later today, there are additional resources that are available for you and your family. So there are videos, yoga videos, breathing techniques, how to cope with current situations, stressful situations, a lot of good information in there. And then also you get a discount program. When theme parks reopen, you're going to get discounts available for that, travel, rental cars, gift cards, things of that nature. So a lot of really good free resources available for you. The next program is through MetLife, and this is sponsored by Stockmens. This is part of the employer-paid life insurance. So you get the same consultation, the 3 face-to-face visits or Skype visits per incident. Additionally, you get other benefits. So you get planning services, will preparation, grief counseling, funeral assistance, and travel assist. Travel assist, if you should travel 100 miles outside of your home zip code or outside of the country, you need medical attention, you lost your passport, you can use this travel assist, and they will help you and guide you, and they need to bring you back to the United States. They will coordinate all those efforts. So you'll get that information also in your inbox later today. Any questions on any of the 2 EAP programs? Okay. All right, good stuff. Now Jose is going to go over in detail what the changes are for the new AFLAC programs.
Thank you, Leticia, and thank you everyone for having us today. What we're doing is a little bit different this year. Last year we had the traditional offering. We've improved the products. So for some of you who don't know who we are, we're the AFLAC supplemental carrier, the duck. So if you get sick or hurt, the duck will pay you cash for receiving medical treatments for your family. So the program has been improved. The benefits are guaranteed issue this year and includes richer benefits for 3 of our plans, including a new program with the cancer benefit. So if you had the AFLAC plans, you picked up a few of them last year, or please make sure that we get to talk to you this year to show you the difference and the comparisons. But for those that are new who might have had it in the past, this is a guaranteed issue group product, and I'm going to go over in detail. So we have the accident plan. For those of you have seen the quacking duck commercials, is what the duck pretty much, you get hurt, you're working out, your child, your dependent children up to the age of 26 gets hurt, maybe after school or hiking or ATVing or during vacation, or maybe your spouse, gets hurt. Could be something small, something, minor injury. You go for urgent care treatment. AFLAC will pay benefits for receiving those treatments, and it will continue to pay, the more severe the injury, the more severe the treatments. So we have a few, examples, but most of the time, most people know that if you get hurt, you kind of go in sequence, go to the urgent care, get an x-ray, get an imaging. If it's something minor, a couple stitches, any kind of burns, any kind of fractures. If it's more severe, this benefit would pay, the new program pays $1,250 for being hospitalized, admitted to a hospital bed due to an injury for the first night, and $300 daily benefit after that. Does have an intensive care benefit of $400 daily benefit, and an initial treatment of $200. So if you go through a basic treatment, diagnostics, testing, if you get picked up by an ambulance, it's $400 ground or $1,200 airlifted. And you do have an accidental death benefit built into this program if it's $50,000. So it's an additional $50,000 for having this plan. The rates can be individual, right? It can be single parent, 2-parent, or employee and spouse. If you have more than 1 child, 2-parent family, up to the age of 26 is still in there. The rates are very, very competitive this year. It's technically a group product, and some of you might have seen AFLAC before. We'd love to compare the rates with you and make sure that it's the right fit. But this is the most probably rich program we have right now that we've ever offered to Stockmens. Actually, through CBR, we've a big improvement on that one. You automatically get $50 wellness benefit per family member per year on this product also. It's included in there. And is, like I said, the accident plan. There is no network. So if you get injured with your skin or you're hiking, you got urgent care, we pay the benefits back to you, usually within 4 to 10 days, or you can direct deposit and they'll do it pretty fast, less than a week on that. So those are the accident improvements for the accident plan. And then we also have a critical illness plan. And this one was a little bit of a big combination. So critical illness can be your heart attack, your stroke, a coma, paralysis, any kind of major organ transplant. And it also comes with cancer, internal diagnosis or skin cancer, but it pays up to $30,000 for you, or up to $15,000 maximum for your spouse. Your children, your dependent, automatically covered at a 50% off your maximum benefit. So if you're the employee and you sign up, it's guaranteed issue, whether you have pre-existing conditions, whether you had a pre-existing history, or your spouse, it's automatically covering because you're being introduced to this new group plan. So I encourage you to look at this coverage as probably one of the best options we have for you. Again, it's supplemental, it's voluntary, you pick and choose, but you can go up to 30,000 or 15,000 for your spouse maximum. It does cover for heart attack, stroke, bypass surgery, major organ transplant, kidney failure, stroke. For the cancer levels, pays 100% of the benefit for any internal or invasive cancer. If it's non-invasive, there's a 25% payout. For skin cancer, you get $250 per calendar year, and you get a $50 per calendar year. You get a $50 health screening for you and your spouse. The children are covered, but they don't get the health screening. It's mom and dad on this one. We do have the most popular version of this in the traditional, but this is probably the best option we've had in offering for CBR. So I'm excited about this one. Please make sure you help us review this one with you if you have any questions on it. It is age banded, so it depends on how young you are. It doesn't matter if you're a tobacco or non-tobacco user. This is a blended unit tobacco rate, so it doesn't matter. It's guaranteed issue. It doesn't matter if you smoke or if you don't. It's blended. The next plan is the hospitalization plan. So some of you say, well, why do I need an accident plan that pays me for being admitted to a hospital? And why should I have another hospital plan that will pay me again if I'm admitted to a hospital? Well, because one could be sickness or injury. So if you get treated for an injury and you're admitted and you have the accident plan, it's going to kick in. But this hospitalization plan will pay on top of it. We do not coordinate our benefits with any other carrier. We don't coordinate our benefits within our own programs. So the hospital plan that we have is sickness and injury, and it will pay $2,000. That's a new improved. We went from 1 to 2 at a very, very competitive rate. $2,000 for the first night in the hospital. You do get a 31-day additional per day confinement of $200 per day for additional days that you're admitted to the hospital. And you have a 10-day confinement for intensive care. You also get $200 per day. If you get stepped down from the intensive care down to, you get a 10-day to a step down unit, you get $100 daily benefit. And this automatically covers the children at no additional cost. Well, it's built into the family rate, but you get a $50 wellness health screening benefit for you and each insured member. So if mom, dad, kids go get a wellness benefit once a year, annual physical checkup, that's a $50 wellness per insured. So those 3 plans have been improved. We're very excited to introduce this to Stockmens this year. I know there was a lot of interest last year, but we try to make it better. So there's a lot of information on those. We are going to try to answer all the questions that you may have. For the short-term disability, you guys get the short-term disability already offered through Stockmens, but if you want to layer up and see how much more you can qualify to get you to your maximum level, we do have that as an individual option. That's only for your paycheck protection. It's only individual coverage. So you can layer up to your 67% maximum if you qualify. So if you're happy with what you currently have, you don't have to look at the short term, but it is an option. So those are our 4 plans, and I went through a lot of details there. So any questions before I go into how we get set up?
Yeah, I have a question. I have an Aflac policy on my own, an accident plan, and it looks like this is paying $200 per initial treatment. Is that, I guess, better than what the other plans may offer? I think right now I get 120 per initial accident.
Yes, you're gonna get, so if you have the accident plan and you have it on your own, hands down, you want to get the new one because this pays $200. So it has been improved and it will be payroll deducted. So yes, I would recommend the accident to switch it up. You do have to get a cancellation form for the old plan if you're switching to the new one. So I'll make sure to get that out to you. You just have to sign the form because this will be picked up starting coverage from 1/1. And we want to make sure you have coverage all the way through 12/31 if you have it. So it's a simple form, but yes, it's a lot richer. $200 just for the initial benefit, just for walking into the doctor's office. It automatically bumps it up $80 to where you currently have it.
And then are the premiums based on like a per person basis, or is it all kind of standard?
It's standard for you guys. It's so if you're an individual, I'm gonna share with you guys the rates are $17.64 just for you, regardless of age. So $17.64 a month. So it's extremely competitive on that. So you'll be glad to see those numbers. Just to share, I was looking at somebody earlier. They have a family coverage. They're currently paying around $56. The family coverage is going to go down to $45 per month. So it's substantially richer. It does have a lot more benefits, and it's just an improved product, but you get in the best rate that we can come up with. So I would recommend you, if you have the accident, you definitely want to switch it.
Okay, thank you.
Okay, anyone else? All right, so let's go through how to get set up. It's pretty simple. We have we have 3 options technically. Definitely talk to me, shoot me a quick email. Most of you have my contact information. There's a time trade option we're going to share with you. It will also be part of your packet if you want to self-schedule. If you don't, just shoot me a quick email, tell me what available days or times. You're going to see the quick contact. The self-scheduler is live. Either myself or one of our agents on my team are going to reach out to you to go over your personalized, one-on-one consult, make sure that the programs, currently what you have, if it makes sense or why not. But we're excited for this. If you're interested, you know what you want, you can shoot me an email, let me know, or call me and we'll schedule your time, or you can self-schedule here directly. But most of you we had a couple of presentations last year, but I think this year we've been able to improve all the products, the rates. It doesn't matter if you live in Missouri, it doesn't matter if you live in Colorado. The product is inside the state, so everyone gets the same coverage. So that was one of the big changes that we had. So this is easier for everyone.
And then on the screen, what I just went through, you'll get this in your inbox today. This form was sent to Audra, but it's just a link where you can go in and drop down the times and pick whatever works best for you. Those are Jose's open times right now. So I know we're going to close the open enrollment on the 13th, I believe. So you have from today until then to go in and pick a time if you already have your Aflac coverage. If you don't have the Aflac coverage, the information is going to be on Darwin, the rates and the plans, and if you feel comfortable enrolling on your own, you may do so. If you need one-on-one help, that's when I would schedule some time with Jose, and then he will talk to you about the plans, talk to you about the short-term disability if you have that and you want, or you do have it if you want to increase that coverage. Yep. So that's how we're going to do that. Does anybody have any other questions for Jose on the Aflac?
All right. Let me know, guys. Thank you.
Thank you, Jose. All right, so we're
Hey,
gonna,
Jose, just really quick, just to confirm, because we have quite a few folks on the phone, it sounds like, who potentially already have AFLAC that they signed up for last year. Can you go through just real quick again, if they already have it and they, want to keep it, what is their best course of action to take?
So if you want to keep it, so we want to compare both of them because, like I said, this year, like the accident, you might be paying last year's rate with the old traditional product. This is going to be an improved product. So it's, we want to go over that. If you have the disability, if you have the critical illness plan or the cancer plan, we want to compare those. You might be, increasing the benefit amount for cheaper rate. If you want to keep it, there's no changes. They're still going to keep the deduction. It's just you won't be able to make any changes to that plan. This is the new offering, so you can keep it as is. I just have to make a note on it, and then that way when we go through the January invoice, we make sure the deductions are still correct, and you guys don't see any changes on that. But it should be, if you want to keep it, say you want to keep the disability, no changes to it. That's all. We just have to make a note of it. So I definitely want to talk to you about it. But a lot of you had one or two plans that for the people that did sign up last year. So we want to compare and help you out with that. Just let me know.
Okay, and then for the comparison, they can either schedule an appointment or contact you via email to get that rolling.
Yes, that's correct.
Okay, perfect. Thanks for the clarification.
All right, thanks.
thank you, Jose. All right, we're going to continue with the voluntary products. So pet healthcare is still available. You do have to enroll online. You can follow the link that's on here or the flyer that's going to come to your inbox later today. I recommend going to the website because you'll be able to search by your zip code to see if any veterinarians in your immediate zip code are participating in the pet care before you sign up. No pre-ex on the pets, no limit, no breed excluded other than fish. So take a look at that. And if you have your pet enrolled, you'll see $1.40, I think it is, increase in 2021, and that's a per month increase. Legal Shield and ID Shield. So the Legal Shield has attorneys that are available at your disposal 24/7 for contract review, consultations, power of attorney, will preparation, and you also have a pretty extensive law library that's available to you at no cost. Additionally, the ID Shield protects or monitors your ID, your credit, things of that nature, protects to make sure nobody's trying to use your information, your social security number, your information to ruin your good name. Now, if you become a victim of identity theft, they will assist in restoring your identity. So they will do all the legwork, which means contacting creditors, the local law enforcement, the credit bureau, things of that nature. Now, you can enroll in just the Legal Shield or just the ID Shield, either one, or both. And there'll be a flyer coming your way later today with the cost per month for yourself or for your entire family. And you do have to enroll online on this plan, and then we will get an email internally and we will payroll deduct. All right, next steps. So everything is due by November 13th. So if you're able to log into the Darwin system and complete your medical, dental, vision, and the AFLAC enrollment, you may do so that way. In the event that you cannot complete the enrollment, you do have a backup form that will be available. We do need to collect two things from everybody, all eligible employees. We need to collect your enrollment form or a waiver and your MetLife beneficiary form. So that's going to go out to you later today, and it's labeled MetLife Form 1. So that's for the employer paid life and AD&D. If you're not going to enroll in any of the voluntary benefits, the life insurance or the long-term disability, the pet, or anything else, we don't need any other forms from you, just those two enrollments. Also, if you wish to enroll in the long-term disability or the voluntary life, complete those separate forms, and they're all going to be labeled accordingly. If you know you have the voluntary life or the voluntary UNUM, you can just write across the same, across the form, keep the same. If you want to know how much you have, contact Nancy here in our office, and she can tell you exactly how much you have, and her email is here and in your packet as well. Send her a quick note and just say, how much life insurance do I have? And you, at that point, you can increase it if you would like to increase it or keep the same. Your flexible spending account, or FSA, that is an annual enrollment. It does not automatically roll over. You will get that form as well. That does need to be completed in order to take advantage of the flexible spending account. And the HSA enrollment is going to be handled by Stockmens Bank. Any questions on anything we've covered today?
Leticia, we did have a question. If an employee opts into either the FSA or the HSA, as well as the health pet care plan, can they use funds from either one of those plans to pay for some of the pet care costs?
No.
Okay.
It's not an eligible expense. Good question.
Perfect.
Though.
Any other questions? Okay, great. Amanda and I will be sending out documents here in the next hour or two. If you don't see those in your email by tomorrow morning, please be sure to reach out to one of us so that you can get enrolled and we get you the information. Again, if you have additional questions, we're also disposed to make sure that we get any of those answered. Leticia, Jose, thank you so much for your time today.
Thank you, and I will send you the YouTube link shortly.
Perfect, thank you.
Okay, I do have a quick question.
Go ahead.
Does Blue Cross Blue Shield have a wellness or a health app?
So they do have a wellness, the app that's going to start in January, and we can send out more information. Now, when you get your welcome packet from Blue Cross Blue Shield, you will also get that information from them. It is a self-paced, self-monitored wellness program. In 2021, it is not tied to any incentives. We are looking at that for potentially 2022. But for 21, it's a self-paced wellness program, and you should get that in your welcome packet as well, or on the website once you create your login.
Thank you very much.
You're welcome. Any other questions?
I have a question.
Yes.
For the FSA, to pay that back, at what rate are they going to take that out of our check?
The FSA, so it's depending on what you selected, it's divided by your pay periods.
Okay. All right. Thank you.
You're welcome. Any other questions? All right. Thank you, everybody. Have a wonderful rest of your day.
Thank you.